Hello everyone, my name is McDonald. I'm a second year master's level student here at Texas Lutheran University, and TLU is my clinical site. So here's kind of like what you see when you come in the front door. Right here to my left is our conference room. As we can see, we have a couple students in here in their natural habitat working. This is where we do all of our rehab stuff. We have treatment tables over here, then we've got one more over there, and we also have taping tables here. On this side, for modalities, we have the Hydroc, we have a BFR, which we use all the time. We've got two game ready machines here, and the X5 machine there, and then another Hydroc here on the end. And back here in the back, we have the wet room. We got fridge for our food, freezer for ice cups, some microwaves, the lifeline for the Keurigs when we have to show up at 7 a.m. for testing. We've got our ice maker with ice bags on the side. We've got 3 whirlpools. This one we normally make the cold whirlpool. We'll do a warm one in here, and then we don't necessarily have to use this one because there aren't enough patients using it. Back over there is our washer and dryer, and then we have lockers for us to use and put our stuff in so everything is nice and neat. Right here in the corner is some of our rehab equipment. We've got TheraBands and ankle TheraBands here. We've got some PVC pipe to help for regaining range of motion. We've got foam pads for balance and working on proprioception. We've got a trampoline. We've got several different sizes of med balls. We've got a Dynadisc for help balance, like the foam over here. Got a couple foam rollers, and then a couple Bosu balls. And then right here, we have some more TheraBands attached to the wall. We've got TheraBands down on the floor for ankle stuff. We've got the Star here for range of motion and balance. And we've got some more Velcro stuff on the floor for like line hops and any other exercises we can think of. More TheraBands on the wall here. More TheraBands on the wall there. We've got BAPS board for range of motion. We use these for step ups or anything else. And then in here, this is our storage closet. And so we've got jackets over here on the left. We've got cold and rainy weather. On this shelf, we've got all of our emergency equipment. We have practice going on, so we have more. But we keep a lot of our supplies in here. A lot of the braces in there and up at the top. And then down here as well. And then we've got all of our crutches and the keys to everything that we need. So now we're going to walk over to the taping tables. And so we have all different kinds of supplies and stuff in all of the drawers and doors. And same thing over here, we've got our cabinet. So this stuff right here is mainly wound care. This is our pharmacologic needs. So we've got pain meds, we've got allergy meds, we've got diatome, and then got some more emergency stuff. We've got ACE wraps, and then a lot of our PPE equipment right over here. And then same thing for down here. Basically, when we run out up top in this, then we come down here, and this is where all of our extra stuff is. And then outside, we have 3 cold tubs. In that room right over there, we have another ice machine, ice bags, some flex wraps, wrap ice bags. We also keep our cows in there for football. And then over here, behind this door is where we keep all of our coolers. So one thing that I find really unique about this setting here at TOU is with the football team, we have several student coaches. And so when we came in as freshmen, we were going to school with them. So we kind of had that relationship already. So that when we have to go talk to them about injured players or updating them on anything, we already have that relationship established, and it's not like we have to start on a whole new slate. So that's what I really like about this setting. So for resources here at TOU, we've got a nurse on campus, we've got a doctor for the mental health side of things. We've got several team physicians that we can get in contact with. We have each other, and then we also have Matt and Amy, which are our preceptors. And now a quick clip from Amy, one of our preceptors, on her opinion for the AT education requirements moving to a master's.
So personally, I feel there are some pros and cons to the athletic training requirements moving to a master's. Two big ones. One pro that I see is that students are finishing their education in 5 years. That's a whole extra year that they are not paying on loans if they're paying for school through loans. But then there are some cons that are to the requirements moving to a master's. One big one that I see is I feel that students are not necessarily getting the full exposure to functioning like a full-time athletic trainer. I also feel that a lot of athletic trainers don't view them or treat them like a full-time just because they're not really certified. So they're watching them more, and the preceptors are very hands-on with them instead of kind of throwing them to the wolves so that they can gain that experience within the athletic training profession. But again, there are pros and cons to both sides of the requirements changing to a master's.